Perfect. I see the people are getting in as well in the actual meeting. So I'll start maybe with the general good morning, everyone. I'm Michele Calabro. I'm the director of EUREGHA. We are a network based on regional and local health authorities, and we're very proud to be part of the Culture and Health Platform together with the colleagues of Culture Action Europe and many others that are with us in the room. Um, Today we're very proud to actually have this meeting, which by the way it's gonna be recorded. So probably you see already some notification on your screen. It's going to be, of course, recorded for the purpose of the project. So if you have any troubles with that, please do communicate it with us in the chat. Colleague from Culture Action Europe, Marie, it's going to monitor that. Same if you have any particular problems. And many while we get to these. And before I also give the floor to our colleague Cornelia Kiss, I would like to just share the few usual housekeeping rules. So we're gonna have during the meeting a little bit of conversation also with Slido. So we would like to also ask you if you want to join that conversation to take a photo of the QR code or join us at slido.com by using the code that you see there or by the link that we're going to put in the chat right now. If you're gonna have questions during the meeting, you can also use the Zoom chat directly. There's no Q&A function, but you can have your questions directly there. And at the same time, we're gonna have time also for you to raise your hand digitally in the second part of the meeting, where we're gonna have a little bit of a Q&A with you and with the speakers. Uh, while maybe I give the floor to Cornelia, I would actually like to open the first Slido poll. It's a bit of a warm up just to check who's in the room essentially. So how many people are from the health sector? How many people are from the culture and arts and other questions? So Cornelia, maybe I'll give the floor to you in the meantime while people respond.
Yes, thank you very much and welcome everybody. Thanks for being there. I just want to give a very short introduction to what you will be hearing later on. In 2019, the World Health Organization came out with a scoping review called What is the Evidence on the Role of Arts in Improving Health and Well-being? This report, and of course also all the work that other researchers have been doing in this field beforehand, resulted in attention to this field, especially because COVID-19 was coming in, and that's where also politicians have felt how it is to be socially isolated, and often many people turned towards arts as well, other than maybe physical activity. And at that time, the Culture for Health project was launched. And during that project that was led by Culture Action Europe, we have seen that artists working in the interprofessional space in culture, health, care, and social sectors, but also the health sector's colleagues were reporting back how many silos there are across countries, and how we also have seen how much differences are across the countries in this field. And this is why we saw the opportunity to launch the Culture for Health platform, which is a 4-year long project funded by the European Union by Creative Europe Platforms grant. And the objective of it is to support and promote emerging European artists working in this interprofessional space of culture, health, care, and social sectors. So what it aims is to provide financial support for artist-led projects that bridge culture and health. It also supports and builds artist capacities. It enables international mobility and also this possibility to learn from each other, actually. We also really proactively would like to raise awareness about the vital role of culture plays in the health and well-being field. And this is why we are very happy that the European Regional Health Authorities also joined this platform. So without further ado, I maybe give over to the oh no, I now see how many people are actually in the room. We also see now on the screen that from the participants, 45% are from the culture and health sector, but we are very happy to welcome the health sector as well with 39%. We also have some 13% academia in the room and other, and we will also see in the Zoom chat soon who they are as well. I think the best is to learn from experts in the field. So definitely, I'd like to give over first to Monica Urian, who is working at the European Commission in the Director General for Education, Youth, Sports and Culture. And she will be telling you what is happening on EU level in this area. Monica, the floor is yours.
Good morning, everyone, and thank you so much for your invitation. Indeed, I have the honor and the pleasure to work on this file on which there are a lot of things going on. So I will try to walk you through in a brief moment. Because we are really at an intersection. I would call it a momentum for a systemic change for culture and health cross-sectorial collaboration. As you said, Cornelia, we are building what we do at the moment on previous experiences like the EU Preparatory Action Culture for Health. And of course, we work a lot with our partners in the World Health Organization that are, it's great to see also them here. But we work a lot with regions and cities because they are a laboratory for experimentation. It's much easier to induce change at this level and then to go to the national and European level. And that's why I'm very grateful for this invitation and happy to be in contact with you now and in the future, of course. I think we need to join forces and do this change together. So what are the signs of this change, of this new era of culture and health? First of all, at the policy level, there are things happening at the moment, and also at the program level. Of course, funding is important, as this culture and health platform is proving to us. We need occasions to meet and to exchange and to learn, and also to give artists, creative professionals, and health authorities the possibility to learn. So the Creative Europe program is funding a lot of projects at the moment, both in terms of cooperation projects, but also the platform, culture and health, and also cultural networks are working a lot on this. And for sure, the health authorities can learn from this experience. I will focus on policy work though, because this is very topical at the moment. So we are preparing right now the launch of a new European report written in the context of the open method of coordination. This is the way that we collaborate with the member states, because the EU doesn't have a direct competence in culture, so we have the role of bringing together national authorities, ministries of culture, etc., to share their experience and learn with each other. So in the context of this process, the topic of culture and health got a lot of importance in these last years. And for the last 1 year and a half, we have been working on this report with representatives from ministries of culture and health, which is really a premiere in the EU work, both in the health sector and in the cultural sector. And this report will be launched next Monday in the Mondial Cult, the World Conference organized by UNESCO on culture policy. Now, of course, it is a cultural angle, but I also encourage you, health authorities, to see when this report is published what is in for you, because we talk a lot about the health sector, and in fact, the representatives of the health ministries of the member states were very active in this expert group. The vision of this report is that people living in Europe have access to culture and creative participation as part of a holistic health journey throughout the lifespan, supporting better health, well-being, and an increased life quality. So I think this is something that we all share. And in order to prepare the future cultural compass for Europe, which will be published before the end of the year, will be like the global framework of the EU for cultural policy. We made a Eurobarometer survey in which we asked people in the EU what they think about the link between culture and emotional and physical well-being. And 87% of them said that this link is very important. So we have a ground here to elaborate future policies in this area. And, you know, in this, the experts that will talk after will say more about the arts and culture and health space, which has been developed in recent years a lot in theoretical framework as well. But I just want to mention a few challenges that we identified in this report, for example, in the health sector, where culture situation of the health sector, the shortage of workers and burnout as well. Also the difficult, the epidemic, let's say, in mental health and the increase of non-communicable diseases. So I think it's important for mental health authorities, for health authorities, sorry, to think that we have something to contribute in this area, both to the health workers and also to patients, or even, of course, in terms of prevention to the general population and prevention and promotion of good health. Of course, there are a lot of challenges, and I will encourage you to look at the report when it will be published. Just to mention a few, of course, we don't have enough practical support for the culture and health collaboration, and the governance is fragmented. There are no, or it's rare in Europe at all levels, local, regional, and national level, that there are structures that are really stable and how to say, take this collaboration further across silos, and where there are competencies and enough support to overcome the barriers, which are natural, I think, when you work across sectors. I'm going to stop there with the report. Of course, I encourage you to see the recommendations. It's going to be very interesting for you, I hope. I just want to mention two more things that also in terms of policy, not only in terms of culture policy, but in terms of health policy, we have made progress, of course. And we work in collaboration with my colleagues in the European Commission in this area. The publication of the Commission communication in 2023 on a comprehensive approach to mental health was a milestone for us. And then we also had the Council conclusions the same year on this topic, because for the first time, culture was mentioned in an EU health document, and cultural participation was recognized as a way to boost mental health, to decrease stigma, and also the models like social prescribing were mentioned as a very promising new model in this area, which includes, of course, culture-based social prescribing. And the other thing, the other policy element is this year's Council conclusions on the promotion and protection of mental health of children and adolescents in the digital era, where again cultural participation appears as an important factor to build self-esteem and self-acceptance, and as an alternative to screens, because we do need in the digital era to work with the youth to give them alternatives to this huge problem. Now, at the local level and regional level, and I'm going to end with this, there are a lot of inspiring projects. This is something that we mapped during this 1 year and a half that we worked on this report. And I just want to encourage you to have a look at the project called Arts and Prescription, which was implemented in the 7 Baltic states, funded by the EUREGHA program, and where there are guides, very practical guides on how to implement in your own regions and cities this type of programs. And I think this is really a huge chunk of the work that will be done in the future. I will stop here because there are a lot of things to say, as I mentioned in the beginning, but hopefully we'll have opportunities in the future to come and update you on new developments. And I give the floor back to you. Thank you very much.
Thanks a lot, Monica, for this very comprehensive overview. And I see that colleagues are also putting the links to the policy dossiers and to the even arts prescription project as well in the chat. So you can also have a look at that. And for sure, Monica, I mean, from our side, of course, we're very glad to have you there, and about the recognition of the importance role of regional and local health authorities, and we'll definitely be sharing, the report as soon as it's out, as much as we can for to get, to our network as well. Trying to see, because I also know that, Monica, you need to leave maybe before the end of the meeting and the discussion moment. If there are any questions in the chat, I don't think I see any for the time being. Cornelia, correct? I'll try to keep an eye, but nothing
No,
for now.
no questions.
But no questions for now. So, Monica, I know that you can still stay with us a little bit. So maybe keep an eye in the chat if there's somebody that's maybe asking for more info on that. In the meantime, also for the newcomers, because I see that we over 54 participants right now. Just to mention again that there's an open Slido that I will post again here in the chat. For now, we're asking, let's say, where you're coming from in terms of your background. But for question and answers, please drop them in the chat, as the colleagues will be happy to respond you. But thanking maybe again, Monica, I would like to pass on to the second part of the second speaker, actually, for today. We're very happy to have Christina Davies, the Associate Professor, Director of the Center of Mental Health and Wellbeing, and Chief Investigator on Good Arts, Good Mental Health Initiative. And I think this is also giving you a little bit of the time, Christina, to see if you can share your slides directly. We're very happy to have you with us and to hear from you.
Okay, hopefully everyone can see my slides. So yes, thank you so much for having me. My name is Christina Davies, Director of the Centre for Arts, Mental Health and Wellbeing here in Australia. So it's morning where you are, but it's evening where I am. I would like to acknowledge all of the health and local government authorities here today, the health, the scientific, the technical, academic, arts and culture experts here today. I'm very happy. I'm going to be talking about arts, health, and the Good Arts, Good Mental Health media campaign. And was this health promotion campaign successful? And just in terms of my background, it's good to know that I am an artist, so I am a painter, but I also have a graduate master's and a PhD in public health. So I'm also an epidemiologist and a health promoter. And I've also worked for my local government authority as a policy officer and also as a senior research and evaluation officer. So in terms of, I guess, the work that health authorities do, you know, I've also, I guess, participated in that work as well. So know how important this sort of thing is. So the format for what I'm going to talk about arts and health, and then a direct application of arts and health in terms of an arts mental health campaign for the general population. That being the Good Arts, Good Mental Health campaign. So the idea, the research that was needed, then the campaign, the evaluation, and then some time for questions. So first of all, you know, what is arts and health? For our definition, we said that it was the direct use of the arts to promote, maintain, or improve health and well-being. So this could be as simple as listening to music to improve your mood, or it can be the introduction of the arts into a setting to enhance health in that environment. So again, as simple as, say, music in waiting rooms to improve, say, patient mood before seeing a doctor. And in terms of definitions, I said I was, you know, an epidemiologist. We like our definitions. So there is an arts and health glossary if you are interested in terms of arts and health. But also all the way through this talk, I'll have QR codes up so that you can actually see the papers. Given that I only have 15 minutes, you can go back to the papers if you're interested in them. So I also want to make the point that, you know, the idea that arts impacts health isn't new. Quite often in health, we forget that, you know, 40,000 BC, the arts was used in ritual and healing. Even our early medical history. You know, Egypt, you've got Imhotep, a physician and a poet. In Greece, you've got Apollo, and he's the god of music and healing. Whether we are talking about traditional Indian, Chinese, pagan, or monastic medicine, arts, music, it's important in healing. If we just focus on hospitals, even, you know, since the Middle Ages, we have been using visual arts and design in our hospitals, and even Florence Nightingale talked about the importance of beauty and aesthetics in medical practice. And on screen, you can see the Nightingale Ward from 1820. So beauty and aesthetic is important. So now jumping to a direct application of arts and health, being the Good Arts, Good Mental Health initiative that's just been run in Western Australia. It's made up of a health promotion campaign, demonstration programs, and also learning opportunities. But I'm only going to focus on the media campaign. But the point I want to make here is that this was mostly funded by our health department. It was also funded by philanthropy, arts, industry, but we were mostly funded by health. So research and ideas. So why do this? So we did this because we have a mental health crisis. This is global, this is national, this is local. We have some solutions that are evidence-based and lifestyle related. So in terms of health, we would focus on, say, physical activity, sport, nutrition, sleep. And as health professionals, we direct these at the general population and also specific target groups. Now, in terms of sport, so in Australia, we have many health promotion campaigns for sport and physical activity. These are some of the campaigns. So the green circle is Life Be In It. This campaign is over 50 years old. So for 50 years, we have been telling Australians sport is fun, but sport's good for your health. So this idea is deeply ingrained in our psyche. Also, during COVID, we had a message called Think Mental Health. So this encouraged us to be positive, be connected, be active. But what it didn't say was do art. And yet, what did so many people do at home while we were, you know, in our homes? We did art. So, recapping, we have a mental health crisis, and yet we have some solutions, but the mental health crisis is getting worse. So this means we need new ideas, we need innovation, we have to take into account individual differences, budgets, lifestyles. I mentioned I was an artist, so, you know, absolutely. As an artist, I wanted to know whether recreational arts could be a strategy for better community mental health. But as an epidemiologist, this had to be evidence-based. It had to, you know, do no harm. Now, I should say to create Good Arts, Good Mental Health, it was 25 years worth of research, but you don't have to do 25 years worth of research. Were major in terms of following health protocols to achieve the results that we did. And one, I think so. And so there were 4 health protocols that we followed. One was we had a definition for arts. 2, we knew what the outcomes were. 3, we conducted a systematic review in terms of the evidence base. And 4, we knew what the arts mental health dose was. And, you know, as health promoters in health promotion campaigns, we will often mention the dose. So in Australia, we talk about 2 fruit, 5 veg, or for physical activity, we talk about 30 minutes of physical activity per day. So, yeah, so 4 main things. So those 4 things, if I go through them, are 1, we defined recreational arts engagement. And there is a difference between recreational arts and art therapy. So we were very much talking about recreational arts, the arts that we do as part of our everyday life for enjoyment, entertainment, or as a hobby. It could be active, so you could make art, or it could be receptive, so say view or attend. And this is within the art forms of performing arts, visual arts, design and craft, literature, online, digital and electronic arts, community and cultural festivals, fairs and events. And 2, we knew the outcomes. So we went to people, we asked, when you engage in the arts, what do you get? And they said it was mental health, social health, physical health, economic, art-specific, identity and knowledge outcomes. But super important, mental health outcomes were mentioned 7 times more frequently than any other outcome. And when they talked about the mental health outcomes, they were actually saying mental well-being outcomes. They were talking about happiness, joy, enjoyment, relaxation. All of it was positive. We conducted a systematic review and we found strong evidence of an arts mental well-being relationship. And then we looked at the dose and we found that 2 hours per week of arts was linked to mental well-being. And for the epidemiologists in the room, this was after controlling for 11 confounders and effect modifiers, those being sex, age group, location, income, education, marital status, whether or not people had children, general health, sports engagement, religious activities, and holidays. Even after controlling for all of that, the arts well-being relationship, the dose stood up. And not only that, but people who engaged for 2 or more hours per week had better mental well-being than those who didn't engage in the arts or who engaged at lower levels. So super, super important to know. All right, so the Good Arts, Good Mental Health campaign, what was the method and how did we run it? So the aim of the campaign was to increase community awareness, comprehension and agreement with the idea that arts could impact mental health. So that was evidence-based. We also wanted to increase intentions to engage in the arts for better mental well-being. And we also wanted to let people know you don't have to be good at arts for the arts to be good for you. Now, this was really important because when we were co-designing, people told us that the belief that you had to be good at arts was a major barrier. And so we wanted to dispel that. We wanted to get rid of that idea. I mean, you don't have to be good at sport to take part. We wanted them to know you don't have to be good at arts to take part. So our target group was adults 18 to 65. We only had a very small budget. We had under 200,000 Australian dollars, which is about 120,000 euros. And the campaign went for 4 weeks, so from August to September 2024. Now, what is significant is that this is a statewide general population campaign of all of Western Australia, which is 2.9 million people. But what is significant is Western Australia is actually 2.6 million square kilometres. So it's roughly the same size as all of Western Europe. Now, in terms of co-designing the campaign, we actually co-designed it with 3,560 Western Australians through surveys, through focus groups, through interviews, also our funding partners, our team from 7 international universities, 31 project partners from arts, health and mental health. We had a community reference group, so community members who assisted us, and also a government mentor group. So I want to say that cross-sector collaboration is absolutely possible. So our health department, our arts department and the Mental Health Commission met with us every 3 months to help design and then run this campaign. So to recap, the tagline was Good Arts, Good Mental Health. The catch cry was, you don't have to be good at arts for the arts to be good for you. And we rolled this out through radio, Spotify, social media, editorials, free and organic media, the campaign website, campaign merchandise, and also event signage and posters. And you can see some of our posts on screen. But one thing I do want to highlight, because our budget was so small, we actually could not afford TV advertising. So if you're interested, because of time, I won't go through it, but you're more than welcome to have a look at the campaign website, which is goodartsgoodmentalhealth.com.au. It has everything on the website is free. So learning videos, there's research, a campaign section. So people who didn't know where to start, they could do the 5-day challenge, the free resources. So everything from colouring sheets through to a Spotify playlist. In terms of radio, so we advertised on radio and Spotify, and our radio ad was, and I'll read this out. So it was music, reading, painting, dance, whatever arts makes you feel good. You don't have to be good at arts for the arts to be good for you. Try for 2 hours per week. It could make a difference to your mental health. Good arts, good mental health. And yes, that is the Australian Prime Minister taking part in one of our drawing challenges with our radio partner, Nova 937. So that was very exciting. But the radio ads they worked really well. We also, like I said, had merchandise, there's some examples, and also that's our campaign poster. And so, the campaign, like I said, ran for 4 weeks across the whole of Western Australia. So now, did it work? So we evaluated through a process evaluation, which was online analytics, and also a short-term outcomes evaluation through an online survey of the campaign target group, and we had ethics approval for this. And what did we find? Okay, so the process evaluation. So we found that before the campaign, we had about 7,500 events to the campaign website. After the campaign, we had 53,810 events. The cost per reach was very effective and ranged from $0 for free and organic media to 10 cents for radio. And also the best reach. So, if you're thinking about doing something similar, the best reach was actually achieved through social media, through Meta. And for 18,000 Australian dollars, we were actually able to get to almost 1 million people. Now, for all the health promoters in the room, very exciting results here. So short-term outcome evaluation found we were able to get to 24% of the population. We had 49% comprehension, which is satisfactory for health promotion, but we had 89% agreement with the idea that doing the arts that makes you feel good could impact your mental health. Also, 42% intention to act on the message. So 42% intention thinking, yeah, this is a good idea. I am going to do the arts that makes me feel good for my mental health. And what's super exciting here in terms of health promotion campaigns, agreement and intention, that's double what we normally get for a health promotion campaign. So it went really well. And even more exciting, if you've got intention of 42%, that can actually be extrapolated to behavioural action of about 10%, which, is amazing for a campaign without TV advertising. But I think, the reason why this has worked is because the idea resonates. So the idea of doing the arts that makes you feel good. So if you like to paint, paint. If you like to sing, sing. If you like to go to concerts, go to concerts. So pick the arts that makes you feel good for your mental well-being. All right, so thank you so much. So, in summary, was the Arts Mental Health campaign successful? Yes, it absolutely was. Was it cost effective? Absolutely was. And should you try arts mental health approaches? Definitely. Providing the evidence base, you should definitely try them. And if you're interested in the Good Arts, Good Mental Health campaign, there is a paper that has been published and the QR code is on screen, but very happy to answer any questions. Thank you.
Thank you so much, Christina. It's really amazing what this campaign has done in Western Australia and how it was all really bottom-up, co-designed with participants as well. So really clap of hands from you. I just wanted to pick up on a question that we saw in the chat, which they were asking about how can we help people in rural areas? There are still people who are very vulnerable, and there is a stigma, taboo, and taboo about psychotherapy. Do you have any suggestions on that, maybe?
I should say, so this campaign was very much about mental well-being rather than mental ill health. Normally I go through, the difference in a talk, which I haven't done today because of time. But I think this campaign was across the state of Western Australia. So it was metropolitan, it was rural as well. I would definitely say that, we absolutely counted on our local government, also arts in rural areas in terms of promoting the message. And we had really good help, I think, when it came to the message, to get the message out there and to encourage people to go to the website, because there are so many great learning activities on the website. And even things that people can download for free. So everything is low cost or no cost at all for people to use. And that's one of the barriers, I think, especially for regional areas, having access. And so with the website, that was one of our ways to try to reduce that problem. But so much more needs to be done. I mean, this is just a little stepping stone in the in what's needed in terms of improving mental health in regional areas. So I don't know, did I answer the question then? Was there more to the...
Yeah, thank you so much. We also saw that Monica has been answering how cultural spaces and local libraries, museums, cultural centers are also great places to tackle stigma related to mental health, because they are not associated with psychotherapy, where there might be some stigma. And also, I was mentioning that the Arts and Prescription project in Latvia, they were collecting people by buses in order to participate in a social prescribing activity, or like arts and prescription activity. But it's very important to make sure that these are not just a one-off thing, but rather, I think research shows that it's like 8 to 10 times. Is that correct? That it's to change a bit of a habit of the people?
And look, the libraries, absolutely, I totally agree. And we, on the website, we actually have for Western Australia a library finder. So you can actually click on it, go and actually see, put in your area and actually find your local library. But there was so much in terms of creating when we co-designed it. The general population definitely said to us, we need to have things that fit into our lifestyle. They can't cost us money. So everything that is on the website, whether it be colouring in sheets, origami instructions, Spotify playlist, you can do a short course and find out more about arts and health. It has like a little quiz that you can do at the end. Everything's been provided so that you can increase your knowledge and therefore be empowered to improve your own mental well-being, whether it be for promotion or maintaining health or to improve health, your mental health. That's the aim, to try to empower people to impact their own well-being.
And a very last question from Niels Fiete from the World Health Organization. He saw that comprehensive rates are around 49%, which is despite the co-design. Do you know why that was, or what could be done to improve this score?
I would say it's because it's the first time the campaign's run. So, yeah, I think, first of all, one of the problems that we had was when we were co-designing, people didn't know what art was. So you'll notice that when we did the radio ad, we said music, reading, painting, dance, whatever arts makes you feel good. And the 4 things that we picked, they're the things that most Australians engage in. So with the ad, we were hoping that by saying music, reading, painting, dance, that at least one of those things would be something that people engage in, and then that could start them on their path for better mental health. So I think that when it comes to comprehension, that's a problem. People don't know in Australia what art is, and what they can engage in. So I think, when the campaigns run again, the comprehension will increase. But that comprehension level was quite good in terms of a health promotion campaign. So I've called it satisfactory. But yes, like I said, agreement with the idea and intention to act for a health promotion campaign, we normally don't get these very high levels. So it's wonderful that the general population are already so engaged. But I think as well, you know, when you co-design something with, you know, the community, it of course resonates with the community. So I think we're on the right track. But yes, definitely, we need more ways to increase comprehension.
Thank you so much. Michela, maybe I give over to you now.
Yes, absolutely. Thanks a lot again, Christina, for answering to also the additional question. And again, if there are more, like, please feel free to drop them in the chat. And it's really nice also that you made time, you know, the different time on the world and to join us. Really happy to have you there. And actually, we can now go to Niels, who I hope also got the answer that wanted from Christina from his question. Niels is indeed, as Cornelia anticipated, from the WHO Regional Office for Europe as technical officers in the Behavior and Culture Insights unit. Niels, we're very happy to have you with us as well. And I know that you'll be trying to share your slides.
I will be trying, indeed. Thank you so much, Michele, for the introduction, the invitation. Cornelia, thanks to you as well, and everybody who's helped arrange this this wonderful webinar. Also to you, Christina, I think I've heard your presentation before, but every time I hear it, I get more excited. My comment was really intended just as that, to probe that question, whether it's because it was the first time. And that was my assumption as well. And I hope you get many opportunities to repeat it. And I hope there will also be opportunities to repeat it in other countries, or for you to guide other countries and suggest how to do a campaign like this in other countries as well. I think you've done an amazing job of pioneering an arts and health campaign. Let's see if we can follow your good example. So I am indeed going to try to share my screen. Let me see if I can manage. You should see my first slide now or soon thereafter. Can I just check, get a thumbs up that it's working? Perfect.
Thumbs up.
Okay. Thumbs up. Fantastic. Thank you. So I've been asked to go through the evidence base for arts and health, and there's absolutely no way that I can do this in 10 minutes. Even with the help of Christina. Christina already provided some really excellent background regarding the evidence base for mental health. I'm going to try to expand that a little bit more, but I'm really only going to scratch the surface, and I'm also going to leave you with a lot of QR codes. They won't have a dinosaur in the middle. I'll have to figure out how to do that. But I guess my call to you is to have a look at those documents. Have a look at all the documents that are being shared in the chat. I think there's a wealth of information that's being shared at the moment, and that's really where the meat of the matter is. It's in those documents, it's in those studies, it's in those reviews. That's where the evidence base lies. Nevertheless, I'm going to try and point you in some directions. So here I go. First of all, I want to start, and I don't know it's already been mentioned in the chat, it's already been linked in the chat. I want to start with a scoping review that we did in 2019. Not because it's the be-all and end-all of arts and health research, far from it. It was WHO's first attempt at trying to put together some of the evidence that was clearly being generated in the 20 years before it. And that we wanted to examine. And I think it left us with a strong sense that there was more to be done here, that there was this was an area that WHO needed to take more seriously, particularly in light with strained health services, rising non-communicable diseases, mental health challenges, a range of complex multimodal health problems that simple biomedical interventions weren't always able to solve satisfactorily. And so the arts and health space, I think, provided an opportunity for us to look at how to contribute to a whole range of health challenges, from health promotion to illness prevention to the treatment and management of disease across the life course. And that's really what this scoping review was about. It was about bringing together, parading the evidence in 2019, parading the evidence, and making some conclusions about here's some strong evidence, and here's what we're beginning to find out. But basically providing an initial primer for those interested in exploring it. But of course, a lot has changed since then. 6 years have passed, and I would probably argue that there's been an exponential growth in research in arts and health across the entire qualitative and quantitative gamut. And so, in fact, colleagues at our Western Pacific Regional Office are now engaged in a kind of an update to the scoping review, which will look at the evidence that has been published since, and provide an update from 2019 to 2025. And we hope that that report will be published soon, if not by the end of the year, then hopefully the beginning of 2026. So that report, the 2019 report, was kind of the starting call for WHO's involvement in arts and health. Since then, we've also been busy trying to increase awareness of the evidence base, and the second picture here is of a recently published systematic review that looked at NCDs. So Christina focused on in her work on the evidence base for mental health, and that's probably one of the strongest areas of evidence for the impact of the arts and the impact of culture. But we also wanted to have a look at the non-communicable disease space. So in collaboration with the Jameel Arts and Health Lab and a number of outstanding researchers in the space, we just published the first systematic review that examines the use of the arts in prevention and health promotion for NCDs. And it includes 95 studies across 27 countries. It represents over 233,000 participants. And it really shows that an overwhelming majority of the studies we look at reporting desirable outcomes, i.e. better diet, better mental health, better physical activity. It also shows that one of the strong points of arts interventions for NCDs is the cultural relevance, that arts enhanced engagement by using culturally meaningful practices and culturally meaningful media and culturally meaningful narratives. It also points out that the multimodal nature of arts allowed interventions to achieve multiple outcomes simultaneously. Like, for instance, dancing increases both activity and social connectedness. And this is really a fundamental component of why we think the arts are a very effective form of health intervention, or can be a very effective form of health intervention. And importantly, the arts also help to illuminate and address systemic, structural, and social drivers of health disparities, like, for instance, racism, poverty, or trauma. So there are multiple ways in which the arts can provide benefits in the space of non-communicable diseases. And again, this is just the start, but probably a good signal for us to do more research and for us to take the impact of the arts in relation to NCD prevention and promotion more seriously. And then the final picture I have on here is of the Lancet series that we're going to be releasing later this year. So that was not supposed to happen. Let me go back to that. So in late 2024, we announced a collaboration with, again, the Jameel Arts and Health Lab, with the Lancet, and with Community Jameel and a number of international authors, to provide a kind of an overview of the state of the field as well as a suggestion or some thoughts by our authors about where the field was moving. And that is going to be coming out very soon. What has just been published, in fact, as this was published yesterday, is a really beautiful photo essay that brings together over 30 international arts-based interventions that have had various impacts on health. So I really encourage anyone who's new to the field, to the arts and health field, to have a look at this or scan this QR code and have a look at the photo essay, because it really is a wonderful synthesis of both the health impact, so the kind of I guess medical scientific side of arts and health, but also leaning very heavily into the artistic side of what arts and health is all about. Now, all of this research that we've been looking at, all of the scoping reviews and systematic reviews that academics have been doing throughout the world, all of the primary and secondary research that's been happening by all the great scholars in this field, we feel we want to capitalize on. And so we've been trying to do justice to our role at WHO of being a bridge between research and policy. And one of the ways in which we're doing this is through a series of policy briefs. So the first one was published a while ago, shortly after the 2019 report, and that's a policy brief on cross-sectoral engagement. As Monica mentioned in the beginning, for this space to work, we have to get better at cross-sectoral work. Christina showed with her project how it's possible and that it's possible. And many of you we have a wonderful split in this room, almost 50-50 split of people from a health background, people from a culture background. These are the kind of initiatives we need to bring the two sides together. But that is not always easy. It's not the culture sector and the health sector have not been traditionally allies, and they have not traditionally collaborated with each other. So there's still a lot to do, and there's a lot of ways it can be done. And that was the subject of our first policy brief. We also published a policy brief on health, migrant health, and the impact that the arts can have there. Again, following in the footsteps of a lot of great work that's been done by UNHCR and others, but basically making the case once again that the arts can be a place of breaking down stigmas, both in relation to migration, but also in relation to the host communities. So, in fact, offering a place of coming together for the migrant and local communities. The other two pictures are of policy briefs that we're in the process of preparing. The first that you see there is one on arts, health, and climate change, and again the kind of intersection of those three spaces, making the very strong case that the arts have an important role to play in the mitigation of health-related challenges that are the consequence of climate change, and also, of course, in the awareness raising of climate change itself. And finally, we have a policy brief on the right-hand side, which is going to be coming out later this year, which is all about the impact of the potential impact for the arts to support youth mental health. And again, this has been a topic, I mean, mental health in general has been a topic that is being flagged on many political levels and many occasions, but youth mental health within that is perhaps even more pressing and even more important, particularly after COVID. So that's a kind of quick roundup of. Actually, one thing I wanted to mention. Maybe I just go back to this this slide to say this. So while we've all, on the one hand, been gathering evidence, while our colleagues throughout the world, researchers have been generating evidence, I think there's also an important shift to reference, and that is a shift that goes perhaps back to the original definition that WHO used or coined in 1948 of health. That health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I think there's a really important change in the way that we conceptualize health these days, in the way that we understand the social, political, economic determinants of health, in the way that we talk about the well-being economy for health, and in the way that we talk about social health these days, and that provide a really important opening for the arts, because it's in that space, in the social health space, where the arts is particularly strong. So that leads me on to another area that I really want to emphasize, where there's also an increasing evidence, an evidence base that's very promising. So an increasing number of epidemiological studies are showing that people who engage in the arts are more likely to lead healthier lives, including eating healthily and staying physically active, irrespective of their social status or social capital. So one example, or a couple of examples of this research coming out of a WHO collaborating center on arts and health, which is based on national cohort studies in the UK, has shown that engaging in the arts and engaging in culture in later life reduces the risk of developing age-related disability by 20%. It reduces the risk of chronic pain by 25%, and increases the odds of aging healthily by 84%. And those are statistics. I mean, I'm just kind of like rolling them out. But the point really is that those statistics those effect sizes are as strong as physical activity. And I think here I really want to take a moment and pause. Because for me, something that is happening right now is a paradigm shift in the way that we can talk about the engagement of culture and the engagement in the arts as a health behavior. Christina was saying in her presentation that in Australia, for the last 50 years, people have been told that sports is good for you. But before 50 years, or longer than 50 years ago, that wasn't a self-evident fact. About 50 years ago, globally, the idea that physical activity needed to be part of a healthy lifestyle, the promotion of physical activity and sports as something that was important to our health throughout the life course, was something that was being discovered, or not discovered, but something that was being evident, and something that was being talked about, and something that was being promoted. To the extent now that we kind of take it for granted, of course, it's obvious that physical activity has a positive impact on our health. And I think this is the stage we're at now with culture and our engagement in the arts. More and more research is showing us that cultural engagement, that arts engagement is a health behavior. And this kind of paradigm change is something that I hope in 50 years' time, or hopefully even less, will be just as normal as the idea that physical activity is good for you. So I'm going to leave on this final slide, and this is a call for arms in two ways. I think on the one hand, I think it's a statement in and of itself, and a statement that I like to make very clear that as the evidence is showing, as the evidence at the population health level is showing, an investment in culture is an investment in health. Early or late in 2024, the United Kingdom published a very thorough review, a groundbreaking study that was commissioned by the UK government's Department for Culture, Media and Sport. And it quantified the extraordinary impact that the arts and culture can have on physical and mental health. And the results in this context indicated that involvement in the arts had a wider societal benefit worth around £8 billion a year at current levels of engagement through people's improved quality of life and boosting productivity and work. Now, this is one study, and we need a lot more of it. But I think this is the kind of work that can really help change the narrative or accelerate and boost the narrative around the investment case, as it were, for culture in relation to health. Now, I say that with the caveat. art is a human right. Cultural engagement is a human right. We shouldn't need to be justifying it as something that is good because it produces health or produces this or the other. Art for art has its role in society. But I do believe that being able to roll out an important statement like this, that an investment in culture is an investment in health, can be beneficial for both sectors, for both sides. So I'll leave it at that, and then I'll hand back to you, Michaela. Thank you so much for your attention.
Thanks a lot, Niels, and indeed great overview on many things. And as you highlighted, I think it's very important that initiatives like these gather, a kind of an equal split indeed on the audience. And when we started to think about this event with Cornelia, that's what we wanted to have as a starting point as well. So I think very good and glad to starting this collaboration as well from today. Cornelia, I don't see any particular direct questions for now, but you can, of course, drop very much any additional inputs, and Niels, maybe I'll ask you to keep an eye on it, and maybe we can pick it up later. As we also go ahead with with also something that's, of course, very important for us, the regional experiences, and we actually gonna have two. From Center Denmark and Region Stockholm first. And we'll actually start with Mikkel Otto, Special Consultant in Health and Culture from the Central Denmark region, which also we're very happy to have as a member of EUREGHA. Mikkel, I think you're sharing the slides already.
Does it work?
There you go. The word is yours. Yeah.
Thank you very much. Thank you for the invitation, and thank you for great presentations so far. I'm really happy with the focus on communication from you, Christina, and Niels. I also have a communications background. I come from the theater business and have a journalism education as well. And I really think that communication is key in arts and health. And we have worked with a lot of different communicational strategies in our work in Central Denmark region, and it's a lot to do with awareness and health literacy, how to become healthy in a positive way, I think. So I'm just gonna let you know a bit about what we've done in the Central Denmark region. We have, for the last approximately 10 years, really tried to champion the field of health and culture here in Denmark. Tried to help the municipalities in Denmark and tried to help other regions in Denmark to improve in this work and to move forward. And it seems that it has had a big effect. So I am a consultant for the region, and this is a map of Denmark. To the south, we have Germany, and to the north, we have Norway and Sweden. And this is Denmark, and I work for the region, which is in the middle on the left side. The biggest city is Aarhus, which is the next biggest city in Denmark after Copenhagen. So I'm actually working for a big health organization, but with a cultural background, and that in itself is rather unique. The Danish regions are primarily responsible for the healthcare system. That includes, among other things, running hospitals and psychiatric services. I am part of a special unit within the region that supports the development of the cultural sector in the region. And as I said, for the past 10 years, we've had a particular focus on connecting the healthcare system with cultural actors. In what we now call the field of health and culture, we have put health first now when we say it. When we first started working in this area, we sort of tried to map the best known international concepts in health and culture, and especially the ones that we could find Danish organizations who tried to spread throughout Denmark. And we found concepts like lung choirs, singing for better breathing, shared reading, an organization who had adapted what they do in the Reader in Liverpool, and dancing with Parkinson's. And we reached out to these concepts, to these institutions, and helped them develop by supporting new research and by helping them spread across the municipalities in our region. After that, we started to support new development projects, which encouraged our cultural actors and our healthcare providers to explore completely new paths and come up with a whole range of exciting new concepts that have changed the way they work in our region. So we have changed the cultural system and we have changed the health system at the same time. Later on, we started collaborating with Niels and with the World Health Organization. When they released their big report in 2019, we reached out and found that they actually had their office in Copenhagen, so they're close to us. And over the years, we've been working together on several projects. One example is the UK-based initiative Melodies from Arms, from Breathe organization in London, which we've adapted for our region under the title of Music and Motherhood. It's now being offered throughout the region in many of our municipalities. It is singing groups for women suffering from postnatal depression. And this is an example of, normally in the cultural and arts field, we try to get new ideas and create something new. But actually in this field, there is a big opportunity just to copy what everyone else is doing or someone else is doing out in the world and try to adapt it to local circumstances. Music and Motherhood has been a great success in our region, a very important project for people in a very vulnerable position. We were also part of the Culture for Health project alongside Niels. So you can read more about Music and Motherhood in the Culture for Health project report. In recent years, we have entered a new phase. We are now focusing on implementing and scaling the best known concepts we can find in our region. That includes making sure that the organizations behind them are strong and able to deliver effective, evidence-based services, while at the same time working to ensure that our hospitals and healthcare system get better at spotting opportunities in these concepts, evaluating them, and developing new concepts themselves. So we're working to improve the cultural side of things and the health side of things at the same time to ensure that there's a good infrastructure in place to help support this field. At the moment, one of our main priorities is to put health and culture on the national agenda in Denmark and perhaps even in the EU. Next week, we're traveling to Brussels to have a meeting with a Danish MEP and a group of individuals interested in this topic to try to raise awareness in the EU. In Denmark, we are actively involved in an initiative to create a Danish National Alliance for Health and Culture. This alliance brings together a wide range of partners from regions and municipalities to universities, healthcare providers, and cultural organizations, all working together in a broad cross-disciplinary network. The aim of this network is to strengthen research, launch major national development projects, and make sure that new knowledge is both preserved and shared across geographic areas, institutions, and professions. This is something we've needed for a long time, and now it seems that we have momentum on a national scale to start working like this. We believe that partnerships and sharing best practice are essential if we want to build real capacity in the field of health and culture. And if the EU, or we on a global scale, can help facilitate collaboration between similar networks in other European countries, then this movement could grow much faster and with much greater impact. Of course, Australia, it would be great also to share networks and strategies and policy on a global scale. We see a real opportunity for the EU to become a front runner in advancing this field across Europe. We saw with Culture for Health that there were attention from all over the world on the project of Culture for Health. So I really think that we have an advantage in Europe, and we would love for other countries in Europe to join us in this work. Then there is policy development. The Central Denmark region we have a political leadership, and we need to get the policy side of things on board. Because health and culture is still a relatively new field, we need to develop stronger policies to create a shared foundation for everyone working in this space. We are now in the process of developing our own dedicated policy for health and culture on a regional level. This will help us future-proof our efforts and hopefully inspire more stakeholders to get involved, not just locally, but also nationally and hopefully internationally. Again, we believe that EU policies and programs can play a powerful role here by giving national and regional leaders the legitimacy and encouragement they need to prioritize this area, especially in relation to disease prevention and mental health, where we know cultural interventions can make a real difference. Again, we would love to know if other countries have made regional or national policies on health and culture that could inspire our work in the field. And then finally, research and innovation. Every time I speak to someone from universities or research organizations, they talk about the need for more research. And this is something we attach to all projects we make, because there is a need for new knowledge about especially the long-term effects on having this focus on the aspects of arts and culture. We know that there's already a very strong international evidence base showing that cultural initiatives have a positive impact on health and well-being. The big questions for us is, which interventions work best? How do we implement them effectively? And how do we scale them up across local and national borders? We believe that the EU can play a vital role in supporting this work by funding large-scale cross-border research and innovation projects that help push the field forward and support the development of state-of-the-art concepts. Could we, for instance, help create a strong network of researchers across Europe or globally who could build a shared base of knowledge that we could use across the EU or globally? I don't know if this is the case in the countries you are from, but in Denmark, people always look for Danish research. But there is so much research around the world that could be used right now. We just need to have a local link to really be able to use it. I really, truly hope that initiatives like the one we're part of today will help us build strong collaborations, both nationally and internationally, that can really push the field of health and culture forward. In the 10 years I've been working in this field, I've seen it grow significantly every single year. With Culture for Health and all of the projects we have set out to do here in the Central Denmark region, we have seen more and more exciting actors have stepped up to support it. We need to make sure that this continues. We need to secure more resources and build greater goodwill. And most importantly, we need to stay curious and keep working to ensure that everyone can enjoy a rich and meaningful cultural life. In Denmark, in the health sector, there's a lot of talk about equality in health. For me, as a person from the cultural sector, it very much seems that equality in culture is about the same things. Social access to culture for everyone, even if they live in rural areas or in major cities. It's not only about giving people access, free tickets, discounts for theaters, movies, books. It's about really letting people in our cultural institutions, in the way we create culture in our society. So that was the words from me.
Thanks a lot, Mikkel, and I see also in the chat that that there are colleagues that most likely will see you indeed in Brussels next week. So also feel free. I don't recall if the registration for the meeting next week is still open, but feel free to drop it in the chat if that's the case.
I don't think I can share it like that. It is more of a direct meeting, so.
All right.
But
Well,
please reach out to me on my email, or if you would like to know more.
perfect. That's good in case you can also have the conversation in the chat. And as we are running a little bit of behind time, maybe what I would like to do is to then go directly to the next speakers, and then we can pick up on questions together towards the end. And we're staying at regional level, let's say, and we're very happy to have Brula Banoharusi. She's strategist at the Competence Center for Culture and Health in the Stockholm region, and of course also member of the Culture and Health Platform project that we're also part of. Brula, I know that I should share the slides for you, so feel free to kick off while I'll try to sort it out in a second.
Please. Thank you very much for inviting me to be part of this webinar, and thank you all previous speakers. I will try not to repeat that much of what Mikkel said, but of course, us also being a regional partner, we have more or less the same issues. So I will try to not repeat what Mikkel said, even though it's more or less the same. I represent the Competence Center for Culture and Health at Region Stockholm, or the Stockholm County Council. And of course, we are just like the Central Denmark region. We are the ones responsible for the healthcare. And we also are responsible for public transportation and something called regional development and also culture. And for us, the biggest advantage that we find working in the arts and health field is that we actually already are a part of the organization that offers healthcare services. Because Region Stockholm obviously finances all the major hospitals and the primary healthcare providers in the county. And just like a simple thing, just like me sending an email to a healthcare provider with the from the domain at regionstockholm.se, that I think tears down lots of imaginary walls, maybe, because when they receive an email from me, it's like, okay, she's already one of us. She understands what our aims are and what we need to do. And we are obviously part of the culture administration. We already also have a very good knowledge about the cultural and creative industry in the region. And many gaps are thus already bridged by the existence of a structured and established arts and health program in Region Stockholm. Since many of the participants here might have little knowledge of the position of Region Stockholm in a national context, it's the second smallest region geographically, but by far the biggest by a demographic point of view, because Region Stockholm has 2.4 million residents, and that is 24% of the national population. And naturally, it's therefore also the region with most caregivers and most universities or higher education services. And it's not only the economic center of Sweden, but we also find that 46% of the cultural and creative industries in the country are active in Region Stockholm. And furthermore, of course, since we are the capital region, we have many of the national authorities working with connected issues to what we are already doing. Like we have the Swedish Arts Council here. We have the public health authorities here in the Stockholm region, and of course, also the public health authorities also have highlighted now the importance of cultural activities for mental well-being. So we find that we are in a status now that we have a lot of things going on for us that makes our work easier. Region Stockholm is a huge organization, obviously, and it has its own regional structures that might touch upon the arts and health field. For example, we have regional centers for research and innovation under regional development, but we also have like a regional public health authority, something called the Center for Epidemiology and Public Health in Region Stockholm. We have centers for psychiatric research, we have academic centers for primary health care, etc. And this is only just mentioning a few. So we at the Competence Center for Culture and Health try to include all these different centers in our work and try to not work in silos, but share our knowledge and share our experiences with them and vice versa. The field of arts and health have been stimulated in Region Stockholm through the culture administration for over 20 years now. And it started with a research program maybe over 20 years ago, focusing on the elderly. And since 2018, we have a special grant for funding artists working in the arts and health field. Today, it's more or less 500,000 euro annually that artists can apply for to have projects in the healthcare system. And about at the same time, the politicians agreed upon that we also needed a competence center for culture and health. And this was born out of the need to create sustainability instead of so-called fireworks, as we call them in Sweden, like fantastic projects where individual artists did fantastic things in different healthcare settings, but like when these projects then were vanishing, nobody could keep up with all the knowledge being made, and nobody registered like a best practice, and there was no evidence as a result of these projects. So they were like born and then they died, and nobody kept track of what was going on. So the Competence Center was born out of this need, and we connect obviously artists and researchers and the healthcare staff. I think we can go to the next slide. I also wanted to mention before maybe I talk about this, that in Sweden, we actually have what Mikkel was talking about. We have an informal national network for culture and health, because I'm here representing Region Stockholm, but in Sweden, we have lots and lots and lots of regions and local authorities doing fantastic things in this field. But we don't have a national coordination. But we have this informal national network in which we share experiences. We try to speak together with the public health authorities, to something called SKR, like the Swedish municipalities and regions, because they also work with these issues. So we try to have a common voice towards national authorities. The idea of the Competence Center is like the departure of the potential of the arts, because we know, because all research shows it, and all the local projects that we have here show that the potential of the arts is immense. And we know also that the healthcare system also shows this need, because when the Competence Center was created almost 8 years ago now, we had to find the healthcare providers that were interested in collaborating with us. Today we have a totally different perspective, because now healthcare providers contact us and say we want to collaborate, and we actually don't have the resources to do as many projects as the demands are. And being part of the culture administration, which in its totality actually promotes the importance of culture and the arts as an inherent part of the social fabric and as an important cornerstone for social resilience or social sustainability. And this is also actually formulated in Region Stockholm's strategic sustainability documents they recognize the importance of the arts there. So we work both with preventive and preventive programs, but actually mostly these times with programs that manage diseases or illnesses, since it's already part of our organization, like we have the hospitals. Many times, like the care functions are at a local or a municipality level. And since we have organizational difficulties and organizational silos, we can't always bridge that gap, or it requires a lot of coordination. So we try to work where it's a bit easier and where we are demanded. Nevertheless, the regional authorities do have a responsibility here in Region Stockholm to even out inequality numbers in public health. And that means that some of our programs actually are targeted towards geographical areas with lower health rates and or shorter lifespans. So we do some preventive work also. During the last couple of years, focus has shifted in the Competence Center for Culture and Health from just enabling a series or a multitude of programs to a more structured and long-term perspective. So we have established a structured methodology from innovative collaborations and co-design to feasibility studies in a smaller scale, pilots of course, and smaller evaluations, so that we can define a best practice and develop that. And the last step is that we also try to encourage research so that potential outcomes and supporting and hindering components can be identified, both for the artists and for the caregivers. And we have identified this as a key issue for fostering sustainable collaborations, because we have to, like this, what we see is like many programs are connected to a certain artist, like we have to try to bridge that and try to create this best practice. Yeah, I think we can go to the last slide. I'll try to keep everything short. We have seen that the learnings and the possible new perspectives that we have found during these 8 or 9 years that we have had this Competence Center for Arts and Health is that we see an overall feedback from the patients about an increased agency. And many of them say that this, like the arts or the program that we have, it makes me feel seen not just as a patient, but as a whole human being. With the creative agency that it creates, I feel seen in my medical context. And we also see that actually it increases the well-being of the caregivers, because many say that it reduces the ethical stress for them. And in therapeutic context, they speak of an increase in the therapeutic alliance that is inscribed. And they often say that this is a person-centered care in a very practical way. So they see that we offer tools to work in a person-centered way. And we also see, and that this is maybe something that we have done the least, is that we have also seen that many of the artists that we collaborate with say that this is also an aesthetic or an artistic stimulation, and it opens up new perspectives even for them. And I just wanted to mention very briefly what we do. We obviously do Dance for Parkinson. We have a program very similar to the Music and Motherhood program. But we are also trying to push some boundaries. One of our biggest projects is working with the Stockholm Center for Addiction Treatment. It's a huge organization with more than 800 employees. They see almost 400,000 patients each year. So we try to have like projects on an organizational level and try to integrate the arts in a more holistic point of view. We have a new project also working with patients with somatic diseases. Like we have a project with some doctors at Karolinska University Hospital with stem cell transplanted patients, because they see that these patients go through an existential crisis, and like the strict medical personnel don't have the capacities to help the patients. So we're trying to evolve something there. It's a new innovation project. We also have shared reading in a unit for forensic psychiatry. So we try to push the boundaries and try to see if like established research can be tweaked, or if we can learn new things. And I think that it's 1 minute to go now, so maybe I have to stop. And thank you all for the attention. And I will, of course, be happy to answer questions if you have any.
Thanks a lot, Brula, and indeed, no worries. I think we'll be on having like a really active and lively conversation. So when that happens, that's the most important thing. And indeed, we planned until 11:30, but I think I would still like to have few minutes more for question and answers. If you can all stay and hold like a few extra minutes, I don't see any direct questions besides the one that were already shared. But what I wanted to do is to open just to help maybe a little bit this 10 minutes last discussion, the Slido that I've shared as well with all of you, just to get a little bit of the sense from the audience. So where do you see, from both, the health and culture sector, the challenges in implementing cultural arts-based intervention? We're going to leave this open for a few minutes, and I see already we have some lack of sustainable funding, some short-term project mentality that are coming up. And maybe while we give people indeed a couple of minutes to respond, Bula, Mikael, Niels, Christina, does this surprise you? Is this something that you've seen in your day-to-day practice, let's say?
I'm happy to kick off with a thought here.
Please.
I think can you hear me?
Yes, of course. Go ahead.
Yeah. No, so I think it doesn't surprise me at all, but I think I would also relativize this and say lack of sustainable funding is probably at the top of most research or health research, health promotion, health intervention agendas. So it's an unfortunate situation that we are in, but I think most other researchers, policymakers, etc., are in as well. So I think part of the creativity of this sector is about figuring out ways of sustainable funding to make things work. Now, I don't want to trivialize the importance of paying for the work that is being done, because there is also a flip side to it, which is that a lot of projects, particularly kind of bottom-up projects in the arts and health space, are done for love. They're kind of done out of the goodness of people's heart. Artists don't get remunerated, people or remunerated very, very little. And that, of course, also needs to change. But I think from the perspective of large-scale projects and from the sides of ourselves as administrators or in public health policy, it's up to us to figure out that sustainable funding within the confines that governments and all departments exist in.
We have a question in the chat. Any advice for artists wanting to get involved besides looking for grants? Well, I would say maybe be in connection with the Culture and Health Platform. We provide a lot of training, capacity building, also artist roundtables where artists share in between themselves what are the best ways or what they felt that worked for them. And this is exactly what we are working on. What I also like to stress, also building on what Niels was saying, is that we had so much bottom-up projects. And this is why, of course, on an EU level and on member states level, we are bringing this into a political level, because we definitely need policymakers, decision makers, to change the way we are now in order to make this possibility to have these projects sustainably funded, or actually not projects anymore, but just be part of the system per se. I see Mikael's hand and then Brula.
Yeah, thanks. So my advice in Denmark is normally that this is very different from like one-off arts projects. This is way more long-term institutionalized projects that sort of should match up with medicine. So we actually need to help the cultural actors, cultural institutions to develop as businesses. So this also calls for partnerships with business developers, which can take many shapes. Those sort of institutions can be found at universities. They can found in municipalities, at regional levels. And most of the time here in Denmark, at least, they are not used to working with cultural actors. So we need to sort of change the system of how we create businesses to be able to react to this movement of culture and health.
And Brula, maybe you want to add something to it.
Yes, I do. I think that what we do most in our everyday life at the Competence Center for Culture and Health is actually translating the aesthetic language to a healthcare language and vice versa. And I would also like to add that I think that the institutional support is the key to have funding. So for us, something changed last year, and now our politicians, our regional politicians, actually gave us the task they gave us as much money as we asked for, and they also gave us the task to apply for more funding so that we could upscale the competence center. So I think that these are also, now we have to match this demand and show that we also have the capacity to upscale. But it's a long way to go, because we have like the organizational silos. We have the silos between the perspective, the aesthetic or humanistic perspective versus the medical perspective. You have different evidence concepts going on. What is evidence for someone in the humanities, and what is it like medically? So you have lots of, it's such a complex field, and we have to try to do this in a way without being activists. At least I can't be an activist because I'm a public I'm a public employee, so I can't. So we have the politicians being activists, and we just deliver. But of course, like, our hearts is with the artists. We want them to be able to provide and contribute to this social change that we all see is needed.
Thanks a lot. Thanks a lot, Brula. And I see also some comments in the chat about, the difficulties as well of convincing policymakers about, the importance of giving that support. And we see that the European level, also in healthcare in general, in particular when it comes to public health, to health promotion and prevention. If we look at the next multi-annual financial framework discussion right now, well, they don't look essentially great for healthcare. So I think there's a good chance for like a joint advocacy, and maybe just to close, also on a maybe more like positive note and outlook. Again, last slide though for everyone. Just asking maybe what enables successful integration. What's like in few words. What's your take? What works? What you've seen has worked on your side. Maybe again, coming again to the speakers, Christina as well. I know that you also had a great project. So any, final words to give to something that we want to see working? Persistence. if somebody from the speaker side wants to come in, of like the one word that that made your project work, what was it?
Well, I think often it's you have to find the one ambassador. I hear often from artists, like the someone who believes in you, and then therefore the collaboration can be better at this point. But we are very much hoping that, of course, this ambassador will be among decision makers as well. But I see Christina's hand is there, and nice.
I think the ambassador is absolutely right. I also think the ability for translation between arts language or arts and cultural language. So that person that can move between fields and present the evidence in the way that health wants to see it, or present the evidence in the way that arts and culture wants to see it and believe it, which we have with Good Arts with Mental Health, that ability to bring together people by talking their language and presenting evidence in the way they would like to see it. But also, what was key to all of this was having the dose. So the dose was important for arts and culture, but the dose is also important in terms of health, in terms of being able to then also translate it to the general population. So I think language is very important here, and presenting evidence the way people want to see it. But I guess as well, it's also about respect, that we're bringing together, cross-sector groups. And so by bringing together two different groups to do a very important project, I think the respect for their language, how they want to see things, becomes very important as well.
And Niels?
Yeah, thank you. I mean, these questions are always impossible questions. Everything that's on there, everything I've read, is super important, and of different importance in different settings and situations as well. From our experience of some implementation, specifically the Music and Motherhood implementation project, I think the core importance was one of the core important pillars were the people. The research partners, the on the ground facilitators, the creative leads, the individuals and the participants as well, the community that was formed from that. So I think at the heart, because arts and health interventions are people-based interventions, right? They're not done to people; they're done with people. It's ultimately the people who are at the heart of everything we're doing.
Absolutely. Thanks a lot, Niels, as well. Any final remarks, Brola, Mikkel, from your side? Any last word that you want to share?
I will just grab the word. I think that projects like the Culture and Health Platform projects are really important in trying to push through, to give the artists the tools that they need in order to work in this field, to help them bridge the linguistic gaps, to help them, I don't know, do this in a professional or economic, business-like way, teach them how to use research for their own advantage, etc., is a really important thing. And from Region Stockholm's part, we are really happy to be part of this project, because many see that the Nordics are maybe way out there doing so much already, but we still have so much to do, and we learn so much from all the different partners. So I think that's great. So more collaboration and trying to help each other when maybe it feels a bit hard.
Very good. Mikkel?
I just again want to emphasize the need for communication, as you also have said, the other speakers. But when you get, for instance, project funding for a project, then it's really important to spend a lot of money on professional communication. And when you come from, for instance, the cultural side of things, then you would really like to make a really exciting cultural artsy communications product, or perhaps just make the standard conference in the end, or a seminar or whatever. But really try to think of innovative, nice ways to reach someone who's not on board automatically. So someone who with a different mindset. I just wanted to show you, we made this nice magazine, which we wanted to look like a normal magazine that you could buy in a shop. But it is a magazine about arts and health with a lot of nice pictures and with a lot of things that some things speak to, there's a lot of numbers, a lot of facts, and then there's a lot of interviews. So it's a mix of things that would appeal to some people and something that appeals to other people. And this topic relates very much to our private lives, to things that we do normally back home, singing or dancing or drawing or whatever. So making a magazine that you could read in your private life as a professional has been a nice tool for us to give to health professionals, for instance, because we can give them a report, a big, heavy report, and everyone knows no one will read it. No one will ever open it. But using communicational tricks has really won many people over for us.
Thanks a lot, Mikkel. Indeed, communication, collaboration. I think practice sharing. That's also something that it's at the very heart of what we do here at EUREGHA, and why we were also interested and very happy to be part of the Culture and Health platform with Cornelia and many other colleagues, and very happy to have activated also our network today for like a first maybe meeting of a different series. For sure, we also try to involve our external networks as well, such as the Committee of the Region, Interregional Group on Health and Wellbeing, or many other coalitions to further spread what we discussed today. We'll also compile a little bit of a report and recap. We'll try to put up the recording as soon as possible for other people that maybe didn't manage to join. And maybe Cornelia, I'll give you the floor as well for some final words from you as well.
Thank you very much. Yes, just last word, really, especially for health colleagues who are here, please also think of yourselves as ambassadors or possible change makers in your systems. And in case you don't know which artist to reach out to or whatever, that is exactly what the Culture and Health platform is about. It's in 12 countries, but we really have also contacts in other countries as well. So we are really there for you to help and think together. And also the Culture for Health project database really helps a lot in finding ways of how to start, which projects to start. So again, we are there for you to collaborate, and don't hesitate to reach out. I'm also dropping my email in the chat.
Thanks a lot, Cornelia, and a big thank to all speakers, Monica, Christina, Niels, Bula, and Mikkel, of course. Thanks, Cornelia, for the great collaboration, and to Marie as well, and all the Cultural Action team and the Cultural Action platform for for being with us with this project. And thanks everyone from the audience for staying with us a little bit longer, but the conversation was very nice. So it's always a pity to cut it as short as maybe we would have planned at the beginning. Thanks a lot, everyone. Have a wonderful day. Let's stay in touch with us, with Cornelia and everyone else, and let's further work on the intersection between culture and health together. Thanks a lot.